The Delhi police have busted a racket involving doctors who were conducting surgeries without the requisite degrees and permissions at the Agarwal Medical Centre in South Delhi's Greater Kailash area. 4 people have been arrested, including 3 doctors. And what's most concerning is that there are reports of post-operative deaths as well. 4 people, including Dr. Neeraj Agarwal, director of the medical nursing home, has been arrested. Also his wife and surgeon, Dr. Jaspreet Singh, as well. In fact, the medical council says that multiple complaints were received by the MCI as far as this particular nursing home is concerned. My colleague Parimal spoke to the registrar of the Delhi Medical Council. Listen to what he had to say.
फर्जी डॉक्टर अगर आपकी सर्जरी कर दे तो सोचिए कि क्या होगा। हुआ वैसा ही। असगर अली की मौत हो गई। 2022 में गोल ब्लैडर की सर्जरी हुई थी और ये GK1 जो पॉश इलाका है दिल्ली का, वहां पे अग्रवाल मेडिकल सेंटर के नाम से जहां पे उनकी सर्जरी हुई थी, उसको लेकर शिकायतों का एक अंबार है। हमारे साथ दिल्ली मेडिकल काउंसिल के रजिस्ट्रार डॉक्टर गिरीश त्यागी हैं। डॉक्टर गिरीश, कितनी शिकायतें होंगी इस अग्रवाल मेडिकल सेंटर को लेकर आपके?
करीब हमारे पास पीछे 6-7 कंप्लेंट तो हमारे पास कम से कम आई हुई हैं, जिसमें से 2-3 में हमने इसके खिलाफ एक्शन भी लिया है। और अभी पुलिस से हमारे पास पिछले अक्टूबर के आखिरी हफ्ते में पुलिस ने हमारे पास करीब 9 कंप्लेंट्स भेजी हैं, जिसमें से कि हम 3 को इन्वेस्टिगेट कर चुके थे। पुलिस से हमने बाकी कंप्लेंट्स का भी डिटेल मांगा है।
तो कितना कंप्लेंट है टोटल, मतलब पुलिस के पास, और कितनी कंप्लेंट है जो आपके पास आनी है 9 के अलावा?
भाई 6 तो ये हो गई उससे पहले, और अभी एक रिसेंटली हमारे पास कल 13 तारीख को एक कंप्लेंट आई हमारे पास, जिसमें कि असगर अली के जिसकी मौत हुई है उसकी वाइफ ने कंप्लेंट करी है, जिसके रिगार्डिंग उसने पूरा डिटेल में कंप्लेंट करी है। उसमें भी हमने कंप्लेनेंट से मांगे हैं रिकॉर्ड्स, जो रिलेवेंट डॉक्यूमेंट हमारे को देने के लिए, ताकि उस पर हम इन्वेस्टिगेट कर सकें।
कुल मिला के दर्जन भर कंप्लेंट है दिल्ली मेडिकल,
दर्जन भर कंप्लेंट हमारे पास हैं। और साथ में इसके खिलाफ एक कंप्लेंट हमारे पास कम से कम मेरे ख्याल कुछ साल पहले आई थी, जो कि कोर्ट ने भेजा था। इसने एक मेडिकल सर्टिफिकेट दिया था किसी आदमी को, 26 दिन का मेडिकल सर्टिफिकेट दिया था उसको कि रेस्ट के लिए। उसने वो मेडिकल सर्टिफिकेट कोर्ट में दिया। उसमें भी जो मेडिकल सर्टिफिकेट हमने पाया कि काफी अनियमितताएं थी। जैसे एक मेडिकल सर्टिफिकेट जब दिया जाता है तो उसमें मरीज के सिग्नेचर होते हैं, उस पर मरीज का आइडेंटिफिकेशन मार्क होता है उसमें, या थंब इम्प्रेशन होगा, या उसमें जो सीरियल नंबर होते हैं, ये सारी चीजें मिसिंग थी।
उसके अलावा जो 2 और शिकायतों का आपने निपटारा किया है, उसमें क्या क्या एक्शन लिया था?
उसमें भी हमने एक में इसका मेरे ख्याल 1 महीने के लिए इसका नाम रिमूव करा था हमने। 1 महीने का नाम रिमूव का मतलब है कि 1 महीने के लिए इसको प्रैक्टिस नहीं कर सकता था वो, इसलिए हमने एक्शन लिया था
जी। और यहाँ पर जो डॉक्टर नीरज अग्रवाल हैं, जिनके नाम पर ये अग्रवाल मेडिकल सेंटर है, उनके पास ये कागज जो है वो दुरुस्त है, मतलब जो
डॉक्टर नीरज अगर हमसे रजिस्टर्ड है एज MBBS और MD मेडिसिन।
और कौन रजिस्टर्ड है सर यहाँ?
एक सर्जन का नाम आ रहा है डॉक्टर जसप्रीत का, वो भी हमसे रजिस्टर्ड है। बाकी जो पूजा अग्रवाल और एक महेंद्र है वो हमसे रजिस्टर्ड नहीं है, यानी वो एक तरह से क्वैक्स की कैटेगरी में।
तो क्वैक्स ने ही एक बार सर्जरी की, जिसके बाद ये पूरा जो है एक मरीज की मौत की बात आरोप सामने में आए।
बिल्कुल। और साथ में अब हम इसको इन्वेस्टिगेट और भी करेंगे, क्योंकि एक जो नीरज अग्रवाल अगर किसी क्वैक से एसोसिएट कर रहा है, मतलब या किसी क्वैक को प्रमोट कर रहा है, अपने नर्सिंग होम में काम करने दे रहा है, या उसके साथ एसोसिएट रहा है, तो उसके खिलाफ उस जो प्रोफेशनल मिसकंडक्ट जो IMC रेगुलेशन का, उसके खिलाफ भी उसमें कार्रवाई करी जाएगी।
पुलिस ने 4 लोगों को तो रिमांड में लिया है, डॉक्टर नीरज अग्रवाल, उनके अलावा 3 और जो वहां पर काम करने वाले लोग थे। अब दिल्ली मेडिकल काउंसिल इसको क्या कुछ कर सकती है आगे? पुलिस अपनी इन्वेस्टिगेशन कर रही है, आप लोग क्या कर सकते हैं आगे?
जो हमारे पास तो जो बाकी जो कंप्लेंट्स हमारे पास जो पेंडिंग है, जो पुलिस ने हमारे पास 9 कंप्लेंट की लिस्ट दी थी, जिसमें से 3 हम पहले ही इसको एग्जामिन कर चुके हैं। बाकी 6 कंप्लेंट्स के लिए हमने पुलिस से रिकॉर्ड मांगे हैं। एक बार रिकॉर्ड आ जाएंगे, कंप्लेंट्स आ जाएंगे हमारे पास, दोबारा उनको इन्वेस्टिगेट करेंगे। उसमें जो भी उसमें कार्रवाई होगी, अगर नीरज अग्रवाल या और भी कोई डॉक्टर उसमें लिप्त पाया जाएगा जिसमें कि नेग्लिजेंस के लिए, तो उसके खिलाफ एक्शन होगा, या प्रोफेशनल मिसकंडक्ट भी होगा तो उसके खिलाफ एक्शन होगा।
क्या कोई जानकारी है कि जो कंप्लेंट आपको आई उसमें जगह जगह पर अपने रिश्तेदार, अपने मरीजों की मौत की बात भी कही गई हो? क्योंकि एक मौत की बात अभी असगर अली की आई है, और भी कोई मौत की बात कही गई जो?
हाँ, पहले भी आई है इस तरह की कंप्लेंट। एक कंप्लेंट थी कि पहले वो कोई लेडी थी जो डिलीवरी के लिए गई थी, पहले सफदरजंग अस्पताल में गई। सफदरजंग अस्पताल में किसी नर्स ने इसको यहाँ नीरज अग्रवाल मेडिकल सेंटर के लिए रेफर करा। अग्रवाल मेडिकल सेंटर में जब आई तो उसकी फिर हालत खराब हुई, दोबारा उसको सफदरजंग में लेके गए तो वहां पर उसकी डेथ हुई। तो इस तरह के केसेस हैं हमारे पास, जो कि जिसमें कि सारे सीरियस केसेस आए हैं इसके खिलाफ। पर ऑफ कोर्स जो डॉक्यूमेंटेशन और बाकी चीजों पे जो केस एग्जामिन डिस्पोज करा जाता है, क्योंकि नीरज अग्रवाल रजिस्टर्ड है ऑफ कोर्स हमसे।
ठीक है, जो भी कार्रवाई होगी वो आप देखेंगे आगे।
जी जी जी।
बहुत बहुत शुक्रिया बात करने।
And Dr. Girish Tyagi is now joining us live on the broadcast. He's the Secretary of the Delhi Medical Council. We'll also be joined by Dr. Sumit Goyal, Head of Neurointervention Surgery at the PSRI Hospital. Also, Dr. Manoj Gupta, Head of the Liver Transplant and Surgical Gastroenterology at the PSRI Hospital. Dr. Tyagi, as we were just listening to that interview that you did with my colleague Parimal, there were multiple complaints that you had received as far as this particular nursing home is concerned. Why was there not a stronger crackdown as far as this particular nursing home is concerned? There were reports of post-operative deaths, which is an extremely serious matter. Do you think there could have been a stronger intervention on the part of the medical council earlier?
Yeah, we received around 6 complaints on which we have taken actions. In one of the complaints, we have removed his name for 90 days. That means for 3 months he cannot practice medicine in the Delhi state. And then he went to the Medical Council of India against the decision of the State Medical Council, and it has been kept in. It has not been decided by the Medical Council of India. In another complaint, we have taken action against him. We have removed his name for 30 days. In another complaint, we have taken. So few of the complaints we have taken action against that Neeraj Agarwal. In one of the complaints we have taken against his father, Dr. D.C. Agarwal. In one of the complaints we have taken against that anesthetist surgeon of.
But Dr. Tyagi, given the nature of the complaints, given the gravity of the situation, do you think this action was enough? Because we are talking about lives being at stake here and the kind of complaints that you received. Do you think this action was enough? Banning the doctor for perhaps 3 months. He's not even a doctor; he's a quack, as you've mentioned in the interview earlier as well. Do you think this was enough?
Because we have not received any complaint in which there was a linkage between between Dr. Neeraj Agarwal and a quack.
Okay.
And yeah. Now, recently we have got the complaint from the police. We have got the list of 9 complaints, after which these 3 complaints have already been examined. Out of these 6 complaints, the police have sent us. We have asked the police to provide us the copy of the complaint as well as the copy of the record, so that we will take action.
Okay, and Dr. Sumit Goyal is also with us now. He's the head of the Neurointervention Surgery Department at the PSRI Hospital. Dr. Goyal, what do you have to say about this? Because this is really a rampant issue, something that we've been seeing across metro cities, and it's extremely concerning that this happened, in such a posh area as Delhi. How do we be careful? How do we actually differentiate a genuine doctor from a quack? Because these quacks have such sophisticated procedure in terms of fooling people and fooling patients. How do we be more cautious?
Good afternoon. I think the answer to this question is pretty simple. I would say it's pretty simple in the sense you need to know with whom you're getting treated. Unfortunately, in our system, people portray that they are, they can do this and they can do that. But at the same time, our medical ethics, our medical board are pretty robust. They have very well, kind of defined who can do what and who is qualified to do what. And people have to really verify before, going for any kind of surgical or for the medical procedure that they are going to the right person. So I really don't see a reason why people may really come out and say that I was fooled by this person and they had done this, and they should meet their doctor. They can verify the details of their doctor. Everything is possible in today's time. So I think people need to be more aware.
So awareness is key as far as this is concerned. But you've made an important point there that you must, as a patient, when you're going in for such an important life-altering procedure like a surgery or transplants, etc., you must also look at whether the doctor is registered or not. Dr. Tyagi, just enlighten our viewers on what is the procedure in place? Of course, a doctor must have a genuine degree, and in this case, that was missing as well. But the doctor needs to be registered as well, should have a license. The nursing home or his private clinic should also be licensed. On how many levels do we have these procedures in place?
Yeah, first of all, the concerned doctor has to be registered with Delhi Medical Council. if the person is surgeon, anesthetist, or a gynecologist, whosoever is treating the particular patient has to be registered with Delhi Medical Council for practicing in Delhi. Then that particular nursing home where the procedure is being done has to be registered with Director General of Health Services under the medical superintendent of nursing homes. That has to be registered. Of course, that nursing home of this Agarwal Medical Centre was registered with the DHS, but
Right.
because of COVID and the fire issues, the renewal was not done of many nursing homes in Delhi. But the nursing home was registered with that DHS also. So wherever the person is going for the treatment, first of all, he should, if he's going for the surgery or gynae or any operative procedure, he should ensure that particular center has to be registered with Director General of Health Services. There is and the nursing home has to display that certificate at that reception also. And the concerned doctor, whether it is surgeon, whether it is gynecologist, whether it is physician, has to be registered with the Delhi Medical Council, and that particular center has to display those certificates also at the registration counter, so that person knows about that to whom he is going for the treatment is registered with the Delhi Medical Council.
Absolutely, but there are times when one misses as a patient, perhaps in a desperate situation. One doesn't really care about certificates and licenses because of the larger facade of of these doctors or these quacks masquerading as doctors. Dr. Goel, what are the red flags as far as this is concerned? How do we know? Because in this particular case as well, there were fake prescriptions, there were fake documents that were doctored as well. So what are the red flags? And you would be the right person to tell our viewers this.
So I think again this is as simple as when you go to somebody, you may really find that the place, you have to see the place, whether the place is really appropriate for that kind of a procedure. It can be a perception. Obviously, there are different grades of hospital, nursing homes, and bigger hospitals where you have different kind of facilities. So facilities may vary, but as you are saying that how do we verify that the doctor is genuine? So as Dr. Girish Tyagi sir has said, there are proper certification criteria, there are proper registration that we are supposed to maintain. We get an repeated messages whenever our registration is kind of getting expired. We need to renew them. So any genuine doctor, which mostly are, they are following this protocol. Now it is for people to be aware, people to have to understand that they should not get lured by false claim. Something which is so good, too good to be true. They have to realize that
right.
Probably a doctor who is not talking about complications is too true to be a doctor. So you have to probably be more vigilant. That is all we can say.
That's a very important point you're making there, that perhaps when a doctor, sort of paints a rather rosy picture and not talking about complications, also prescribing too many tests is seen as a red flag as well. Prescribing vaccines and injections in the first meeting, that is seen as a red flag as well. Dr. Manoj Gupta is also with us. He's the head of liver transplant and surgical gastroenterology in the PSRI hospital. Thanks very much, doctor, for joining us. How do you look at this? And as somebody, and as a surgeon, how grave the situation is, because lives are at stake. These are complicated procedures that we are talking about, and extremely shocking that this happened in the heart of the national capital. How do you look at this? What do you think should be the procedures in place that we can avoid such a situation?
Yeah, actually, being a surgeon, I always see, like I am working here at PSRI, where we are having all the facilities available. So a doctor who is going to operate at a center, he must also be aware of the whereabouts of the hospital, the setup, the equipments, and the facilities available at that center. So from doctor's point of view, correct, we must, before going ahead for any procedure or any surgery, you must be aware of about the whole setup and where you are going to do the surgery or that procedure.
And Dr. Tyagi, I'd like to give you the last word. What do we do going forward? Because, this case happened in Delhi, which is why it has received the kind of attention that it has. But such cases sort of continue to plague rural areas, semi-urban areas. Of course, you have, multiple such cases in states like UP, Punjab, Haryana on a daily basis. They're not even reported. Do we need to have more robust corrective measures in place? And also perhaps how do we strengthen our crackdown mechanism as well as far as these quacks and fake doctors are concerned?
Yeah, first of all is the awareness. Awareness about to the general public, that they should go to the qualified person, registered nursing homes or the hospitals, and as Dr. Manoj told about that, they should not be lured by that fake promises or the false promises about that cheaper treatment or so. So if they are not able to pay, they can go to the government sector, but not to those kind of centers which are providing fake promises and false promises and false claims that they are claiming for that matter. Awareness is the most important thing for that matter.
So awareness is key, as you said. And, Dr. Gupta, before I end this discussion, as a surgeon, what are certain, important prerequisites that patients must focus on? And what, as I asked Dr. Tyagi also earlier, what are the red flags that, this is a fake surgeon? And what are certain prerequisites that patients should, in a sense, look out for?
Yeah, correctly, as it was discussed before also in this forum, on this forum only, there are certain parameters for which a patient should see or should be aware of, whether this doctor or this center is properly registered or not, or degrees are correct or not, and there are always an option for second opinion. And Tyagi has correctly said, if don't go with the cost only. The cost should not be the only factor. If there is a cost constraint for the patient, then there are so many. We are having at the capital. There are so many renowned government hospitals where every other kind of surgery can be done. So.
Absolutely, and as you said, there's always room for second opinion, especially when you're going in for such important and complicated procedures. As I said earlier, you must seek second opinion as well, and perhaps from somebody who's reliable and who's known to you as well. Thanks very much, gentlemen, for joining us.